What if I told you that the single most powerful thing you could do for your intimate life tonight costs absolutely nothing, requires no pills, no doctor's visit, and no special equipment, and most men over 50 have no idea it even exists? Stay with me because what I'm about to share has transformed the relationships of hundreds of my patients, men just like you, who thought that chapter of their lives was quietly closing. It's not. Not even close. I'm Dr. Jocelyn Carter, a board-certified urologist and men's health specialist with 5 years of hands-on clinical experience helping men in their 50s, 60s, 70s, and beyond rebuild confidence, connection, and passion in their intimate lives. And today, I'm going to have the kind of honest conversation that most doctors never take the time to have with you. It might feel a little uncomfortable at first. Good. That means we're getting somewhere real. Before we go any further, if this channel is new to you, hit that subscribe button right now and smash that like button so more men can find this information. And I want you to drop a comment below telling me where in the world you're watching from. I mean it. Whether you're sitting in a farmhouse in rural Texas, a flat in London, or a beachside home in Florida, I want to know. This community stretches farther than you'd believe, and every single one of you matters here. Now, let's get into the truth. Here's what too many men have been quietly told, either by society, by silence, or by their own fear, that after a certain age, deep intimacy is basically behind them, that the awkwardness, the distance, the disconnect in the bedroom is just the new normal, that they should accept it and move on. That is one of the biggest lies men over 50 are fed. The problems most men face in their intimate lives aren't permanent. They're not signs that the body has quit. They're signs that certain habits, certain beliefs, and certain conversations have been avoided for far too long. And today, we're going to fix that. We're going to walk through 5 critical mistakes men make around intimacy. Mistakes that are silently killing connection, killing confidence, and killing passion, and exactly what to do instead. Stay with me all the way through because mistake number 1 is the most powerful shift you'll ever make. But I have to build to it because if I give it to you now, it won't land the way it needs to. Let's start here. Mistake number 5, treating vaginal fluids like something to be ashamed of. I know, this is the part where some of you shift uncomfortably in your seat. Do it anyway, because what I'm about to explain is pure biology. And once you understand it, you'll never look at intimacy the same way again. Vaginal fluids are not random. They are not messy inconveniences. They are one of the most sophisticated systems the human body produces. Think of them like a perfectly engineered lubricant designed by millions of years of evolution, doing a job that no pharmaceutical company has ever been able to fully replicate. 3 sources work together to produce these fluids. The Bartholin's glands, sitting near the vaginal opening, release a silky secretion specifically designed to reduce friction and make intimacy comfortable. The Skene's glands, sometimes called the female prostate, respond directly to arousal and add additional lubrication. And the cervix produces a protective mucus that maintains the delicate chemical balance of the entire vaginal environment. What are these fluids actually made of? Mostly water, but also amino acids, the raw building blocks of proteins, enzymes that neutralize harmful bacteria, minerals including calcium and zinc, and lactic acid that keeps the environment slightly acidic, which is nature's own defense system against infection. This is not waste. This is the body's internal pharmacy, protecting delicate tissue, fighting off infection, and creating the conditions for safe, pleasurable intimacy. But here's what happens when a man pulls away from these fluids, or worse, makes a face, a comment, or a quiet gesture of disgust. The woman notices. She always notices. And deep inside, a question forms that she may never say out loud. Is something wrong with me? That question plants a seed of shame. And shame, left unaddressed, grows into self-consciousness, withdrawal, and emotional distance. She doesn't pull away because she's stopped wanting connection. She pulls away because she's protecting herself from feeling rejected in the most vulnerable moment possible. So here's the mental shift I want you to make today. Those fluids are not a problem. They are a signal. They are her body saying, I trust you. I feel safe with you. I am ready. When you accept that, Genuinely, warmly, without hesitation, you give her something that no lingerie, no candle, no romantic dinner can replicate. You give her safety. And safety is the foundation that everything else is built on. Mistake number 4, making judgments about taste and smell. This is the question men whisper to me when the door is closed and they think no one else is listening. Doctor, what about the smell? What about the taste? So let me give you the answer you actually deserve. Not a polished, evasive non-answer, but the biological truth. Variation is normal. Completely, entirely, scientifically normal. What influences how fluids taste and smell? Diet is the biggest factor. Pineapple, citrus, and good water intake tend to create lighter, fresher profiles. Garlic, onions, red meat, alcohol, and coffee push things in a stronger, more pungent direction. Hormones shift everything throughout the month. Around ovulation, fluids tend to be clear, mild, and neutral. Near menstruation, a faint metallic note may appear due to trace amounts of blood. After menopause, declining estrogen can reduce fluid volume and shift the chemistry slightly. Stress matters, medications matter, sleep matters, even the time of day matters. No two women are the same, and no two moments are the same for the same woman. Just like no two men smell identical after a long day or after a workout, she is not the same every single time either. And just like you wouldn't want her to recoil from your natural scent, she does not want to feel scrutinized for hers. Acceptance here doesn't mean pretending you notice nothing. It means understanding that what you notice is human, natural, and nothing to transform into criticism. Now, here's an important footnote. If there is a sudden, significant change in smell alongside symptoms like itching, unusual discharge, or a strong fishy odor, that's usually a sign of a common, easily treatable condition. Bacterial vaginosis, a yeast infection, trichomoniasis. These are medical conditions, not moral failures, and a single doctor's visit resolves them. That is not a deal breaker. That is an opportunity to show up as a caring partner. The mistake is turning normal biological variation into a silent verdict. Gentlemen, here is something I've watched play out in hundreds of patient relationships. Acceptance is more arousing than any technique you could learn. When she feels accepted, she relaxes. When she relaxes, everything deepens. Mistake number 3, skipping the safety conversation. Is it safe? That's the next question, and you deserve a straight answer. For healthy, mutually tested couples, yes. Vaginal fluids are predominantly water, enzymes, and protective compounds. In biological terms, they carry less inherent risk than many things we do daily without a second thought, like kissing or sharing a glass. But here's what I need you to hear clearly, because this part matters. Fluids can carry sexually transmitted infections. Chlamydia, gonorrhea, herpes, syphilis, trichomoniasis, HIV, all can be transmitted through vaginal fluids. The risk increases significantly if one partner has an active infection. It increases further if the receiving partner has mouth sores, bleeding gums, or small cuts that create an easy entry point for pathogens. This is not fear-mongering. This is biology. And biology doesn't care about how long you've been together or how much you love each other. But here's the beautiful flip side of this truth. When both partners know their status, when you've been tested together and you share that information openly, fear dissolves. You move from anxiety to confidence, from guessing to knowing, from tiptoeing to full presence. The practical fix is simple. Get tested together. Make it routine. Twice a year is a healthy standard for sexually active adults. Frame it not as suspicion, but as partnership. Let's take care of our health together so we can enjoy each other without worry. Use protection in new relationships or when status is unknown. The mistake is assuming that no visible symptoms means no risk. Many infections are completely silent. True intimacy is built on transparency, and transparency requires the courage to have this conversation. Safety does not kill romance. Safety builds trust, and trust is what makes passion last not just months, but decades. Mistake number 2, letting silence build a wall between you. I've watched relationships quietly collapse, not because of illness, not because of age, not because love faded, but because of silence. A change in smell goes unmentioned. A question about safety goes unasked. A curiosity about trying something new stays locked inside. And over weeks and months, those unspoken things pile up like bricks between two people who still love each other, but can no longer find their way through the wall. Biologically, the body never stops changing. After menopause, after surgery, after a shift in medication or diet, fluids change, arousal changes, response times change. None of that is failure. That's life moving through a body that has lived and loved and worked hard. But emotionally, when one partner withdraws without explanation, the other partner fills in the blank with the worst possible story. He's not attracted to me anymore. Something is wrong with me. We've lost it. She doesn't know you're struggling with a question you don't know how to ask. She only knows you've pulled away. And she pulls away too. Not because she stopped loving you, because she's protecting what's left of her dignity. Practically, small, unaddressed issues quietly grow. A minor infection becomes chronic discomfort. An unasked question becomes unspoken anxiety. And slowly, intimacy goes from something you share to something you avoid, even while living in the same house, sleeping in the same bed. The mistake is silence. The solution is a conversation, imperfect, a little awkward, and delivered with kindness. You don't have to have the right words. Try, "I've noticed something feels a little different lately. Are you feeling okay? Can we talk about it?" Or, "I have a question I'm a bit embarrassed to bring up, but I trust you completely. Can we figure this out together?" That kind of courage doesn't weaken a relationship, it saves it. Mistake number 1, forgetting that full acceptance is the ultimate performance enhancer. And here we are, the big one, the one I've been building toward this whole time. When a man accepts his partner completely, her fluids, her scent, her sounds, her natural self in all its unpolished, unfiltered humanity, he communicates something that no gift, no gesture, and no grand romantic moment can replicate. I choose all of you. Not the version of you that's convenient or perfect, all of you. Biologically, that acceptance triggers a cascade. When a woman feels genuinely safe and accepted, her nervous system shifts out of threat mode. The fight or flight response quiets. Blood flow increases to all the right places. Natural lubrication deepens. Sensitivity heightens. Her entire body opens up to connection in a way it simply cannot when she's bracing for judgment. Emotionally, your acceptance heals something that may have been wounded long before she ever met you. Many women carry years, sometimes decades, of quiet shame about their bodies. Shame from inadequate education, from media that treats the female body as a problem to be fixed, from a past partner who said something careless that cut far deeper than he ever realized. When you accept her without condition, you undo that. You tell her, without a single word, you are not too much, you are not broken, you are exactly right. Practically, that shifts everything. Intimacy becomes joyful instead of anxious, playful instead of performative. There's no hiding, no second guessing, no holding back. Just two people choosing each other, fully, freely, fearlessly. Here's what I want you to understand. Men over 50 often think the path back to a great intimate life runs through performance. Duration, technique, stamina. Those things have their place, but they are secondary. The most powerful thing you can do for your intimate life is make her feel completely safe and completely accepted. When she does, everything else takes care of itself naturally. Your 3-step action plan, starting today. You now have the truth. Here's how you put it into motion. Step 1, have the health conversation. Suggest getting tested together. Frame it as teamwork. Let's do this for us so we can be fully present with each other. Twice a year, routine, an act of love, not suspicion. Step 2, pay attention without judgment. If something smells different, invite a shower together, not as correction, but as connection. Encourage hydration. Gently support her in seeing her doctor if she's noticed changes. Approach everything as a team. Leave a glass of water on her nightstand. Draw a warm bath. Small acts that say, "I'm here, we're in this together." Step 3, practice acceptance daily. Her natural self is not a flaw. Her body is not a problem. When a judgmental thought surfaces, pause. Ask yourself honestly, is this thought bringing us closer or pushing us apart? Then choose, deliberately and lovingly, to move toward her. I know some of you are still sitting with a little discomfort right now. That's okay. This is vulnerable territory. But I want you to know, every man who has ever sat across from me in my clinic has asked these same questions. Every single one of them felt alone in asking, and every single one of them looked visibly lighter when they realized they were not. When men stop hiding and start connecting, truly connecting, I've watched intimacy not just survive the years, but deepen in ways they never expected in their 60s, 70s, and beyond. So here is your final truth, gentlemen. Passion does not have a retirement date. Your best, most connected, most confident years are not behind you. They are available to you right now if you choose them. Let go of shame. Embrace full acceptance. Care for your health as a team. Don't chase gimmicks. Don't waste money on miracle promises. The real breakthrough is already within reach. It starts with understanding, it grows through honest conversation, and it becomes something extraordinary when you choose your partner, all of her, without reservation. If this video reached something inside you today, hit that like button, subscribe so you never miss what's coming next, and share this with a man in your life who needs to hear it. And drop a comment right now. Tell me where you're watching from, and tell me what you want me to cover next. I read every single one. I'm Dr. Emily Carter, and I'll leave you with this. Small shifts in how you think, how you speak, and how you love. Those are the changes that bring freedom, confidence, and real intimacy back into your life. Passion does not expire, and neither do you.